and the volume has definitely increased. We had planned throughout this pandemic for a surge, so the plans that we had hoped to never use, we're now having to use them.
The emotional strain of, potentially preventable illness, seeing really young patients now die. I don't know what the long-term kind of mental health effects will be for myself and my colleagues. All I can say is it's tough.
Everyone is just so burnt out and tired, and we're literally working on the very last drop of fuel that we have. We're not the front line anymore, we're the last line of defense. And it's been so difficult in that regard. My name's Amanda Rampersad, and I've been a respiratory therapist for 4 years. So my job involves airway management, as well as management of life support, as well as providing oxygen therapy. In the ICU, it's almost triple of our workload. One day we had 4 to 6 cardiac arrests during the day. There were patients coming down left, right, and center from the wards to our ICU who were just failing from COVID. You don't really know at this point what you're walking into, but you know that it's going to be very, very bad.
My average workday is probably 14 to 16 hours a day for 7 days a week. My name is Dr. Elizabeth Wilcox. I'm an ICU doctor at the Toronto Western Hospital. So last week, which was one of the busiest days that I can remember in my career, I walked approximately 23,000 steps, which is 17 kilometers. People might have heard about proning, which is essentially when we put people on tummy time. So we roll them from their back to their front, and that actually improves their oxygen levels. And to do that, that can take 4 to 8 people, and you need a physician in the room, you need a nurse in the room, you need a respiratory therapist in the room. So it can take 45 minutes to flip a patient safely. If we have 2 or 3 patients a day, then that's not too laborious, but now you're looking at dozens of COVID patients in a unit.
It's a tenuous situation right now. There's no two ways about it. And the utilization of the bus is just another way that we can maximize the way that we use the paramedics. My name is Justin Smith. I'm the Chief Flight Paramedic at Orange. The volume that we're moving out and the regularity with which we're doing it is not something I've ever seen before. COVID is taking out entire families, like entire families. Not just a grandma or a grandpa, but a mom and a dad and an aunt and an uncle and a brother, all from one family. And that is not a rarity. So that's what scares me, because that's going to continue.
I think that's what a lot of people don't understand or necessarily see is the moral distress and the compassion fatigue that a lot of frontline staff are going through. We're there and we're trying to hold our patients' hands like through the very end of it. Not being able to do that is what takes the toll.
To provide kind of that human component is probably the most rewarding part of our job, but it's also the most emotionally taxing. And to have to do that over the phone, to listen to someone cry and break down on the phone versus being able to hold their hand or, give them a hug at the bedside, it's the saddest part of the pandemic for sure.
Yes, we have experienced death and dying before. This is a part of our job, but it's just a completely other different level of it. I remember coming home from a shift and someone in their 30s had passed away. And I went to bed and I looked at my husband and I said, "Oh my God, that could be you."
When you get into this type of work, you understand that at some point through your career, you may be asked to do something or be part of something that's extraordinary, and this is that thing. So for me, I sort of lean on that.
I have an amazing husband and an amazing family who are there for me. And we also got a puppy this year, so he worries about me for sure. If I come home crying after a shift, he runs and he jumps and he tries to lick my tears away, so.
I can't worry about the long-term effects because we're gonna be paralyzed, right? And so, this is what we train to do. this is what we're gonna do, and how much therapy am I gonna need afterwards. I've gone from once a month to every 2 weeks. My therapist probably thinks I need weekly, but we're doing okay. We're doing okay.
We good to go in? Whenever I go into an ICU, people are trying to keep it upbeat, right? You can see that they're actively trying to not let it get them down. That's something I've not really seen, that sort of active participation in making sure that everybody else is okay, even if they're a stranger. How are you? Are you keeping okay? So that gives me hope.
The human race has survived many pandemics, right? And so eventually this is gonna end, and maybe the pandemic will highlight different inequities in our society that maybe we'd actually be more motivated to change. There's always something bright that comes out of tragedy, and I think that that's probably what it's gonna be.